Even younger Indians are being affected by lifestyle diseases. The first three most important causes for this increasing epidemic of lifestyle diseases is lifestyle. Cardiac troponin is that it can detect a heart attack very early. Within an hour, the heart enzymes start appearing in the blood.
Heart care begins by being heart aware, and Roche Diagnostics Raho Dil Se Fit campaign is trying to do just that, spreading knowledge about heart health far and wide. September 29th marks World Heart Day. It's a significant occasion, particularly because there's a growing awareness about heart disease, heart health among the younger generation, the younger individuals. Hello everyone, I'm your host Sonali Swami, and I am a dedicated athlete and a health enthusiast. And today I am honored and privileged to be joined by our esteemed guest, Dr. S. Venkatesh. Hello, Doctor.
Hi.
Dr. S. Venkatesh currently serves as the lead interventional cardiologist at Aster RV Hospital in Bengaluru.
Thanks, Roche. I think it's a very important program where we can spread awareness.
Yes, I'm really looking forward to it, and I'm sure everybody is going to benefit from this session, and it's going to be extremely insightful. So let's get started. So, Doctor, here's our first question. Studies show that cardiovascular diseases strike Indians a decade earlier than the Western population. So has this gap increased in the recent years?
I suppose yes. This kind of data that the Indians are struck at a younger age, they have more severe disease, poorer response to treatment, etc., is all from about 2 decades ago. But since then, I think there is a lot more that has happened, and I think even younger Indians are being affected by lifestyle diseases. So I would now think if somebody looked at it very closely, we may have this gap being wider still, in the sense that Indians may be affected at even younger age than this 1 decade gap between the Caucasians and our populations.
Okay. So what are the factors contributing to the growing burden of cardiovascular diseases, especially in the young individuals?
This is a very commonly asked question, and I think the answers have been done to death. But then I think it's worthwhile reiterating it. The first three most important causes for this increasing epidemic of lifestyle diseases is lifestyle.
I agree.
I think from, let's say, 5 decades ago, we have moved from a very healthy lifestyle to a very unhealthy one. Today, I think the epidemic of processed food, lack of exercise, and stress, and our habits, more smoking and more alcohol in the community, especially in the younger people, I think it leads to, it has led to this kind of a growing numbers of lifestyle diseases like hypertension, diabetes, blood cholesterol, and cardiovascular disease.
Right. So what do you have to say? I mean, campaigns like Roche Diagnostics, Raho Dil Se Fit, how do you think, how is it, would it spread the awareness amongst the people?
I think it's an ongoing process. Today we consume a lot of news and data from social media. We get alarmed when our WhatsApp messages or Facebook messages spread this about somebody dying in a gym or a young person succumbing to heart attacks. But then that kind of fear psychosis leads to more stress in the society. At the same time, it's a short-lived knowledge. People forget about it and they move on. I think more awareness in the form of scientific discussions, spreading of knowledge, actual information about what needs to be done, why these things are happening, is more important than just noise about a stray incident, which can just make us more fearful but not knowing what to do. So I guess in this direction, campaigns such as these, especially on important days when people remember about heart, that we have one and we have to take care of it, I think is very important.
Absolutely. I completely agree with you. In fact, I absolutely discourage people from forwarding messages, especially on WhatsApp group, because there are, elderly people, our parents are in these certain groups and they keep forwarding certain messages. It's always better to get your facts from the authentic source, such as yourself. So Dr. Peeler, people panic about everything, smallest things. So what are the warning signs that people shouldn't ignore?
Well, when it comes to heart disease, before we think about symptoms, we should also look at what are the risk factors. People tend to forget that all of us are at risk because of the times and the way we live. We are all at risk. So if somebody gets a symptom, many times what happens is people simply don't think that I could be having a heart attack, for example. So you would see a person going to a chemist and asking for antacids or taking some antacids at home remedies, etc. They won't think about it. So I think the first thing one has to know is that all of us are at risk, however high or low that may be, and one should look at ourselves, like what are the risk factors which I am carrying? Do I smoke? Do I have hypertension? Do I have a family history of heart disease, etc.? And then the symptoms. The most important symptoms for heart attack are chest pain and breathing difficulty. Right. If somebody gets a chest pain, especially in the middle of the chest, and it goes to one arm or the other, or the back or the jaw, then there is a possibility that one may be going through a heart attack. So this, I think, is a very important symptom to recognize. If you have chest pain, one has to seek medical attention at the time.
Okay, so does that mean that we have to be cautious all the time, in the sense that people are scared to go to the gym or go for a walk, or probably at certain age they just feel that I may have something, I could get this, I could get that. So keeping that in mind, is it like absolutely necessary to be on your toes all the time?
Well, I guess one needs to be a little sensible about it and not be panicky. I didn't mean when I said that all chest pain has to be a heart attack. I didn't mean that. What I said is that if somebody has chest pain, for example, at a particular point of time, goes to a doctor, checks it out, and the next day, if a similar pain happens, and the doctor is assured that it is not after doing tests, then I suppose one could ignore that. So it's not that every time one has to panic. Right. But at the same time, you brought up a very important point that we are now a lot of people are scared of exercise and gym. It has, especially when some of these incidents are reported in the social media, people get worried about it. But it's like this: gymming or strenuous exercise can put a person in at risk if it is done in an unplanned manner. So we see a lot of times that people kind of scale up. They want to become fit overnight, or they want to join a marathon running,
or not training probably not under a guided somebody who's knowledgeable or
yes. And I think sometimes they are egged on by friends and coaches who kind of unrealistically scale up their exercise. And also one other thing which I keep telling my patients is that just because somebody exercises, I go for a 5-kilometer run and I can't get a heart attack, is not true, because it also is a part of the rest of your lifestyle. True. Somebody who exercises but continues to smoke or take alcohol in excess or have healthy food cannot be protected. So exercise has to be a part of a lifestyle, a whole some plan, and not just something to mitigate the risk because
there are other factors involved as well, important ones.
Absolutely.
So doctor, before we move on to our next question, how can we prioritize heart health? Like I'm an athlete and I'm also a coach, so I stay fit. I try to stay fit and I try to make healthier choices most of the days, but there are days when you would fall off wagon. So this is what I usually tell all the people, every single one, irrespective of the gender and the age, that you need to move your body and move it often and make better choices. I know it cannot be 100%, but go for better choices in general. So what do you have to say?
Well, a prioritization of heart health has to be under two heads. One of them is, as you rightly said, lifestyle. You have to eat better. You have to move your body. Exercise is very important. And then smoking and excessive alcohol have to be limited. Smoking has to be stopped completely, and alcohol has to be in moderation. So this pertains to lifestyle. And then there are other things like risk factors. So if somebody has to take care of her heart health, they have to look at their own risk. What are the risk factors which we are talking about? Hypertension, that is high blood pressure, high blood cholesterol, diabetes, family history of heart disease, and smoking. So once we know that whether we have a few of these or many of these risk factors within us, we try to modify them.
Right.
You try to control the blood pressure or stop smoking. Obviously you can't change your family history, you can't change your families, but then at least the ones which we can modify, we have to get on top of them. We have to seek medical attention to see how can we diagnose our conditions, how do we control these conditions. So both these, that is getting on to a better lifestyle and watching our risk factors and modifying them, are both very important for prioritization.
So on to our next question. What is the difference between heart failure and a heart attack?
So there are actually three different terms which are thrown about: heart attack, heart failure, and cardiac arrest. Now the first one, the most catastrophic, is the cardiac arrest. Cardiac arrest is when the heart stops for some reason. It could be because of an extremely slow heartbeat, or the heart stops beating, or it could be another situation where the heart beats very fast. We call these as ventricular arrhythmias. There are two important ones called as ventricular tachycardia and ventricular fibrillation. In these situations, the heart beats so fast that there is actually effectively no pumping coming out of blood coming out of the heart. In both of these situations, when the heart beats extremely fast or when it stops beating, the blood supply to the brain and other vital organs stop, and the patient loses consciousness, and the person can lose life in case not resuscitated quickly enough. So that's a cardiac arrest.
Okay.
And one of the commonest causes of cardiac arrest is a heart attack. Now then, what is a heart attack? Heart is a muscle. It's a pump which is made of muscle, and it pumps the blood into the circulation. But to function, heart itself needs energy, oxygen and nutrients. And to the heart, three arteries, colloquially we call it as three arteries, though there are actually two, but three arteries of the heart supply blood to the muscle of the heart itself. And in case, for some reason, if the blood supply was to be cut off, typically happens when there is a clot formation within the arteries and the blood doesn't flow anymore in that artery, and that area of the heart muscle which was getting blood supply from that artery will start getting injured. The cells start dying, and that is called as a heart attack. Typically, when somebody has chest pain, that is the time when a clot has formed and there is no blood flow through that artery, and the muscle is like crying for help, and that's a heart attack. And the third one is heart failure. For many reasons, if the heart doesn't pump efficiently, and let's say its pumping capacity has become very less, and it's not able to pump out enough blood which is required for our body, then patients can experience symptoms. The lack of oxygen in the tissues, and it commonly presents as swelling of the feet, swelling of the face, and sometimes water accumulates in the lungs, and because of that patients can become breathless. So their capacity to work reduces. So that is called as a heart failure. Now these three are separate terms, but many times are interrelated, because sometimes the underlying reason is the same, which is basically cholesterol deposition in the heart arteries, which we call as blockages or atherosclerosis. Okay. So most of the times, this is the root cause of all of that, and it can lead to these three different, what we call as syndromes, that is heart attack, heart failure, and cardiac arrest.
Okay, so for a layman, somebody who's a relative and who sees, who experiences or who witnesses somebody who's going through such a thing, I think for that person, all three would look similar.
Not
because
really.
The symptom would be somewhat similar?
When somebody has a cardiac arrest, the person collapses,
Okay.
loses consciousness, breathing stops, and when we check the pulses,
Okay.
you would have seen in those CPR videos or Baywatch where they resuscitate people, they check whether the pulse is there, whether the person is breathing or not, whether the person is conscious or not. So that state of unconsciousness when there is no breathing and no heartbeat, that is a cardiac arrest. So it's very dramatic.
Okay.
Chest pain is when somebody is having a pain, so they're able to tell you. And in both the other conditions, when there is heart failure, when there is extreme breathlessness, or when there is a heart attack where there is severe pain, many times we are able to give attention, medical attention, by taking that person to the hospital. Whereas a cardiac arrest is an immediate situation where we have to act upon immediately.
That was very informative, very insightful. So doctor, everybody knows about ECG and echo. Can you elaborate upon the blood tests and enzymes that you just mentioned?
So when a person is having a heart attack, whether it is a minor heart attack or a major heart attack, the blood flow to an area of the heart muscle stops. So the muscle cells start dying. Actually, the muscle cells have an injury. When there is an injury, the membrane of the cell membrane of that muscle cell, the integrity of that is lost. So within the cells there are certain enzymes and they leak out of the heart muscle itself. So, and they appear in the blood. So one could potentially take a blood sample from such a patient, analyze that blood sample to see if this enzyme has been released. Now the most commonly used enzyme, and perhaps one of the best available in medical field, is what is called as cardiac troponins. There are several variants of that. The troponins, cardiac troponins, are specific to heart muscle. So when they come out of the heart muscle and we detect that in the blood, we are fairly certain that it is a heart attack. And these are very sensitive tests. Even a very small amount of cardiac troponin which is leaked into the blood indicates that some muscle injury is going on. So we know that it's some kind of a heart attack. And these are also fairly specific in the sense that very few conditions other than a heart attack cause an elevation of cardiac troponin. So if somebody goes with a chest pain and we do a cardiac troponin test and it comes as elevated, we are fairly certain that almost certain that we are dealing with a cardiac condition and it is a heart attack. So it's quite a effective test. And the good part about cardiac troponin is that it can detect a heart attack very early. Within an hour, the heart enzymes start appearing in the blood. So at the end of 1 hour, if the blood test is done and if the troponin is elevated, we know it's a heart attack and we can give early treatment, because early treatment matters. And on the other hand, if the test is negative at the end of 1 hour, generally it is again repeated after a certain period of time to see that initial test is not picking up and later test picks up. But the time duration which person spends in the emergency is very small, in the sense that, let's say 2 tests of cardiac troponin is done in an emergency room 1 hour apart.
Okay.
Person has a chest pain, goes to the emergency, you do a test, comes normal, another test 1 more hour apart, comes normal. Actually we can send the patient home. We can reassure the patient. There's a lot of money saved because the patient doesn't have to stay in the hospital for expensive tests. Also there is a huge psychological relief saying that, okay, I don't have a heart problem. You don't have to get hospitalized for observation, etc., which used to be the norm a few decades ago. So cardiac troponins have made life easy for both the patients as well as the cardiologists.
So doctor, what do you believe is the most significant barrier for patients to not opt for NCD screening, such as diabetes and CVDs?
Well, I think the most important barrier is access. Access in terms of physical reach. We are in an urban setting, we can walk across to a diagnostic laboratory or a doctor's clinic, whereas the swathes of Indian population may not have that kind of access. Even though the government has taken it as a priority to screen NCDs, non-communicable diseases, that is cardiovascular diseases, diabetes and cancer, there are areas where access is limited. The other part obviously is financial, because tests are expensive, doctors' consultations are expensive. So because of that also people kind of fall back on that this thing. So the barrier is access and we need to make it better.
Okay, doctor. So here's the last question. With advances in diagnostics, there are cardiac risk profile tests. So when do you prescribe young patients to undergo cardiac risk assessment?
Well, in India, we have heart diseases much before, let's say, the Caucasian population. So if screening for in the West starts at say 50, it should start earlier than that, maybe 35 perhaps. But then I have a little difference of opinion compared to some of the leaders in the field of cardiology. We have heard some very senior cardiac surgeons speaking about everybody in the country should have a coronary CT scan.
Okay.
Well, it's not a right advice, I think, because first of all, coronary CT scan has its own problems. It has radiation, it has a dye which is injected. It can detect blockages which are inconsequential and then put the patient through a lot of what we call as downstream testing. Somebody undergoes a coronary CT scan and then ends up with an angiogram, and also sometimes treatments are more harmful than being beneficial. So, and also the other thing which we have to think is, if you look at our population of 1.4 billion, I think 400 million of us are eligible for a CT scan. I and you should also get one, according to the popular saying. We don't have that much resources. What is the cost burden on that? So I think first is that we should look at risk screening, like find out what stage of diabetes one is at, what is the hypertension, get good preventive advice, lifestyle, diet, smoking cessation and moderation of alcohol, etc. On the other hand, as you said, technology has advanced a lot. There are a few tests which are available now to identify cardiac disease early. Some of these are called as biomarkers. There is a test called as high sensitivity CRP. It is been seen in certain studies that it can predict upcoming cardiovascular diseases. So it's a biomarker, it's a blood test which can be done so that people can be diagnosed.
At any certain age?
Well, when people go for a risk screening, as I said, typically after 35, some of these tests which will include the cholesterol, sugar and blood pressure checking, also this is added, and that can additionally tell us whether the person is at risk. The other important biomarker which we talk about in cardiology, which is very important both for treatment as well as detection of a condition called heart failure. I told you about heart failure where the pumping capacity of the heart is less and efficient pumping doesn't happen. Sometimes conventional tests are not able to diagnose the presence of heart failure, and then there is this test called as NT-proBNP. It's an important biomarker which can tell us ahead of time whether the person is going to have or already has this condition called as heart failure.
Okay.
This biomarker also helps us to treat the patient. If somebody has florid symptoms of heart failure and we have a certain level of NT-proBNP, and then we put that patient on treatment, and looking at the level of NT-proBNP, whether it is rising or falling, we can see the response to treatment. So yes, there are few biomarkers which are important in cardiology, and they are kind of used in clinical practice as well.
So I would like to know if this is something that you would recommend?
Well, I recommend that when we feel it is the appropriate time, we should go to a physician or a doctor, practitioner. We have to go to a physician or our family physician or a practitioner, and that person should go through our history. What is our physical activity? What is our diet? Do I smoke? Do we take excess alcohol? And then look at blood pressure measurement. It's not a test which can be done in a lab. And then you look at the cholesterol profile, you look at the sugar profile, you look at the family history, and come to a conclusion as to what is the risk, possible risk for this patient. We have tables which can tell us what is the chances that in the next 10 years one of these persons can get a heart attack. So based on that, for the tests, treatments, everything should be designed.
Wonderful, doctor. Thank you so much. This was immensely enlightening, very insightful, and I'm sure all our listeners would benefit from this session. So thank you so much for being part of this conversation.
Thank you for having me here. It is a wonderful occasion, World Heart Day. I think it's a reminder once again for all of us that we should take care of our hearts, and I wish yourself and your viewers all the best.
Thank you, doctor. Okay, all you lovely people, do not forget to follow Raho Dil Se Fit campaign, and do download the patient's information guide from the healthwithdiagnostic.com. Stay fit and Raho Dil Se Fit.